29 states have put their faith into legalizing medical marijuana. Illegal marijuana users need treatment help, and medical marijuana could help. Is jail time beneficial? Law enforcement are proven to be racist. According to a journal article, Who's Using and Who's Doing Time? Incarceration, the War on Drugs in Public Health by Moore in 2008 says, persons of color compose of 60% of the incarcerated population. In 1996, blacks made up 62.6% of drug offenders in the state prisons. Nationwide, the rate of persons admitted to prison on drug charges for black men is 13 times that for white men. And in 10 states, the rates are 26 to 57 times those of white men. People of color are not more likely to do drugs. Black men do not have an abnormal for intoxication. They, however, are more likely to be arrested and prosecuted by their use. It also says, the prison system is designed to remove a criminal from society, but it leaves an equate system to cope with in what is left behind. A virtual member of both a family and a community is gone, weakening emotional family and community ties. Prisons are typically located far away from the cities in which most of the inmates live. For a family, the cost to go visit them is more than most can afford. Children lose contact with their family and parents when they have to be kept in jail. Another question, doctors. Doctors are asking many questions about medical marijuana. The doctors ask, is this the right move? According to the journal article, Medical Marijuana by Grimspoon in 2018 says, there are few subjects that can stir up stronger emotions among doctors, scientists, researchers, and policymakers than the topic of medical marijuana. It is safe. Is it safe? Should it be legal? Is it discriminative? Has its effectiveness been proven? What conditions is it useful for? Is it addictive? How do we keep it out of the hands of teenagers? Is it really the wonder drug? Is it medical marijuana just deployed to legalize marijuana in general? Doctors just don't know. There's so much to research from it. It also states, the most common use for medical marijuana in the United States is for pain control. Why marijuana isn't strong enough for severe pains, such as post-surgical pain or a broken bone, it is quite effective for the chronic pain that plagues millions of Americans, especially as they age. Part of it is that it clearly safer than opioids. It also can take the place of medicine as Advil or Aleve if people can't take them due to problems with their kidneys. Now, the ways medical marijuana help with health conditions is stated in a journal article, A Growing Interest in Medical Marijuana by Keith Lurie in 2018 says, Grimmel, which is a PTA, works with a patient who has multiple sclerosis that produces leg pain that often is horrible. The patient's leg twitches in spasms, causing him to jump when he's in his wheelchair. These episodes can make it difficult for Grimmel to follow a PT's plan of care. With medical marijuana, it helps him ease his symptoms, which then helps Grimmel properly give him the right therapy. Now, you're all probably wondering, is medical marijuana the future? I think the future is bright. Medical marijuana helps with all sorts of different health conditions. It can help decrease the tremors for Parkinson's disease. It can help with anything in your nerve system. It can help with just plain back pain or with your severe migraines that you could have. In conclusion, medical marijuana is the best solution to a better life for people across the world. Illegal marijuana users need treatment, help, and medical marijuana could help.